it's hard to talk with the tongue in the roof of your mouth, so my neck is starting to stress out a little bit, so I put my tongue in the roof. Okay, so that's dead bug. Okay, the next step would be to use an unstable surface. So you can see I got a small stability ball here. Okay, and then you could go to a Bosu ball, which isn't as unstable, or a foam roller. That's fine too. I'm just using this ball. So again, you could bridge up, draw your belly in, and then lift one leg off. Everything's slow. Switch one leg off. Okay, and you can bridge here. All right, you're going to get more range of motion being high up on this ball. You can do it one leg at a time. You're going to really feel that in the hamstring. And again, you could use this, use a Bosu ball or a fitter or a foam roller, anything you want, okay? Okay, now instead of putting my feet on an unstable surface, I can put my back on an unstable surface. So right now I have my back on a Bosu ball, but it could also be on a stability ball or on a foam roller, any of that, okay? So again, I can bridge, do hip extension, right? Like that. Okay, then draw my belly button in, and then try and lift one leg at a time. It's very hard. Not too good at this. Do one-legged hip extension. Okay. Pretty good. Okay, now you can try dead bug on the Bosu ball. Much more challenging. Not easy to do. Okay, now we're going to start something called horse stance, or they call it quadruped stance or 4-point stance. Okay, so get your hands or wrist under your shoulders and your knee under your hips. Okay? Draw your belly in slightly. And then make believe somebody's just trying to slip a piece of paper under your hand. And very slowly, just lift the hand off the ground. Switch hands. Okay, so now we're going to progress. Now if somebody has a wrist problem, you can have them put their fist on the ground. Okay, so again, see my belly? I'm going to breathe out and pull it. See, I'm slightly drawing in, but you don't see me move here. It's not this. It's just a slight drawing, okay? Then again, you can go to where you're slipping a piece of paper under the right hand and the left foot, simultaneously extending, abducting, bringing back. You can do circles. Okay, a circle this way with the leg, the other way with the hand. You can play with that. You could to switch legs. Drawing the belly button, you can draw the alphabet, A, or just with the hand, or draw the alphabet with your heel, C, D, E. The whole idea is what you're doing is you're challenging the deep muscles of the spine. So what you're doing is, for example, you know the muscle spindle that's a proprioceptor. Well, I read or I heard in a seminar once that in the rotators, the intratransversary, the deep muscles of the spine that attach to the transverse process and the spinous process, that they have anywhere from up to 500 muscle spindles per gram of muscle tissue, as opposed to in the quad, there might be 9 to 16 muscle tissues, muscle spindles in a gram of muscle tissue. So basically what that tells me is there's a lot more proprioception close to the spine because it's protecting your spinal cord. So any slight movement, these smaller muscles will get to integrate. So that's where you want to start with that. Then you can go to unstable surfaces. You can put your knee on a Dynadisc. Well, let's see, I'll go get one. Okay, so now I got my knees on Dynadiscs, so that makes it more stable. So okay, I'm going to draw in my belly. Okay, I'm going to go flat hand on this. And I'm going to go right, left leg, well, I'm going to go right leg up. Left arm, right leg. Back. Okay? And you can put stuff under your hands. It's pretty infinite. I've seen people do this. Kind of looks funny, like a dog on a fire hydrant, but basically you lift your leg and down. Draw in, lift your leg and down. Draw in. Now this starts to look like kind of like a side plank in yoga. All right, you can go to here. Okay? But basically you're doing these very slow. Okay? Good. Now lastly, this is also good for lower abdominals. Remember, you have innervation from T5 all the way under the belly button. I think under the belly button your abs are innervated by the ilioinguinal ligament and the iliohypogastric ligament nerve. Ilioinguinal nerve and the iliohypogastric nerve. But they're basically, you have 8 sets of nerves here in your abs. So a thing you can do is, again, lift your knees off, straighten your legs out, keep your back flat, and slowly bring your legs down. Now your client should be able to keep their back flat and then back up. Just a leg raise. Okay? Got all kinds of cracking going on for me. Okay, so I hope that helps. It's kind of a conservative approach to back pain. There's a lot more exercises to come, okay?